News.
On Afternoons with Helen Farmer.
We've just been discussing social media addiction and an unwanted byproduct of the amount of time that we are spending hunched over our phones and laptops is tech neck syndrome. According to an article in the Washington Post, smartphone users spend an average of 2 to 4 hours per day hunched over, reading emails, sending texts, checking social media. That's 700 to 1,400 hours a year. So the posture has become so prevalent that it now has a name. Joining us on the line to help, a doctor who treats this condition on a regular basis, Dr. Mohamad, Raslan, a chiropractor at Biraa Clinic here in Dubai. Dr. Mohamad, how are you?
Good. How are you?
I'm a bit worried I've got tech neck, to be completely honest. This sounds like me. Definitely a few hours a day, hunched over a laptop or over my phone. Can you explain what this looks like in non-chiropractor, normal people terms that I could understand?
Yeah, I mean, lately we start to see in the clinic teenagers coming with a neck pain. Brought by their parents mainly, and some adults who they come complaining about a shoulder pain and neck pain, thinking it is something probably related to their disc problem or something, and it turns to be all related to use of devices. The teenagers, they come with I mean, the symptoms in general is a neck pain, and this neck pain going down to their shoulder blades. We see that the neck is limited in their range of motion by turning right or left, and it's painful while doing the movement. When we do the examination, we find that there is a huge muscle spasm, tightness of the muscles of the neck and the upper shoulder. Then we usually ask the patient to go and do an X-ray. Well, the X-ray is shocking sometimes to see an X-ray of a 17 or 16 years old teenager that the X-ray looks like this person is 50 or 60 years old. We could see in the X-ray how the tightness of the muscles, how the vertebrae itself it's affected. The curve of the spine has changed. Because when they are young, the bones are not strong and they are
more pliable.
And yes, they are possibility of a curve to change. And we've seen, I mean, a lot of different. It depends on the severity of the case. Usually, when we see that, we go and discuss, their lifestyle, when they do what they do, and we start, of course, the advices and the treatments.
Start putting together that picture of how long are you spending on your phone and what position are you in when you're using your phone or laptop? I mean, I'm sure like many other people listening today, I'm sitting listening to you, trying to sit up a little bit taller, rolling my shoulders back, kind of feeling for any kind of, blocks or pain. Yep. Because this, as we were just talking about with psychologist Dr. Saleh, this is very much part of normal life now, using a phone for hours a day. Rightly or wrongly, there's no real getting away from that. But are there any exercises, things that we could try to offset or rebalance something that is very much part of day-to-day life?
You see, the head weighs about 5 to 6 kilos, and the spine was created to carry this much of a weight at the time. But when we change the position of the head and put it in a different angle, then the weight increases on the muscles and on the bones and on the ligaments in the neck, and that will increase the weight to more than 15 or 20 kilos by putting the head in the wrong angles. So what should be done mainly is to bring the device to the eye level, not to bring the head down to the device, whether it's a phone or a computer or a laptop or whatever it is. So try to make the screen at the same level of the eye. They should, take a break. They should leave it, for every 15 minutes, stand up, to do some stretches to the neck, to the shoulder, move the neck right and left, forward and backwards, move in the room a little bit, and then come back. But the main thing is to have the device at the same level of the eye. That's the main thing. And of course, when the patient comes to see us, we do try to correct the curve, that the wrong one, and put it back into position. And those vertebrae that they were out of its place because of this long, hours and days of putting the head in the wrong position, the vertebrae, they get misplaced and misaligned, and so we put them back into position and try to relax the muscles and the ligaments in order for the spine to go back to the the normal position. But then after the treatment, if the patient keeps doing the wrong thing,
everyone's going to go back to doing it. I'm the same when I go and see the osteopath. I'm like, yeah, sure, yep, I'll do those half hour of exercises every day. You can count on me, and I do absolutely nothing until the following week. But I think in honesty, even us having this chat today will hopefully clue, definitely me, but hopefully others, into what we're doing on a day-to-day basis and making some slight changes, and even if it's just sitting on the sofa and going, hang on, I can do this better, will be preventing an awful lot of pain. I mean, it might stop patients coming through your door, I'm afraid, by having prevention rather than cure. But thank you for your insights today. I think really, really valuable, Mohamad. As I said, you can be found there, chiropractor at the Biraa clinic here in Dubai. Dr. Mohamad Raslan, have a wonderful, wonderful afternoon ahead. Really appreciate your insights, and take care of yourself. Mohamad there talking about one of the symptoms of tech neck being intermittent or even constant headaches.
Healthy Habits on Afternoons with Helen Farmer.
Almost one